Waiting for some time for this thing to start. As Mr. Abu Bakr has already told you about Apollo Hospitals, Bengaluru, and its characteristics and its advantages. So I am a senior consultant and professor of ENT as well as head and neck oncosurgery. I perform both ENT work as well as I do also head and neck surgery or head and neck oncosurgery. The reason why I'm saying head and neck oncosurgery is because one of the commonest things, one of the commonest patients who come to me from Bangladesh are people who are having some cancer in the head and neck. The typical thing about head and neck cancers are the problems of smoking, the kani, the alcohol, other things. These are things that cause head and neck cancers. And it's one of the commonest things not just in Bangladesh but also in India. So a lot of patients do come to us for treatment of these cancers of head and neck. So this is the Apollo Hospitals, Bengaluru. Just now we saw that. It's a quaternary level multi-speciality hospital along with an oncology center, complete in all aspects. Coming to my area of expertise, so maybe I'll just talk about a few things. I'm sure you've heard all these names. Minimally invasive surgery, endoscopic surgery, robotic, scarless surgery, laser surgery, mini incision surgery. Now you go to a patient and ask, he says, I want mini incision surgery. He does not know whether it's possible or not, but he will say, I want mini incision surgery. He will say, I want laser surgery because he feels laser will give the best cut and best treatment. Or he will say, I want robotic surgery. But then many of these are not feasible in all surgeries. Some surgeries it is feasible. So just a few words about what this means. If you see the head and neck, the area that I deal with, what is it? It is the face that we present to the world. Everybody sees us. If something happens in the area, it can be seen to everybody. You can't hide it in a dress. So it will be definitely seen to everybody. Secondly, it also has some special areas like the eye, senses that we call eye, the nose, the taste, hearing, the ears, all these are in this area. And more than that, there are some more things which are very important, like speaking, swallowing, breathing. This also is from these areas. So imagine whenever you have a small thing, even a common cold, it affects you a lot. It affects your nose block, your breathing, your swallowing, your taste, everything that gets affected. So imagine a bigger disease that is there in this area, how much it troubles a person. So there's a lot of trouble that happens to a person when the head and neck area is involved. So that is why I find it's a very important